So I'm going to introduce our next speaker, who is Priyanka Sood, and she's going to be talking to us on how to manage flap complications with LASIK.
Great. Okay. Thank you to the Planning Committee for having me today to speak on management of flap complications. So here are my financial disclosures. So if you're a surgeon and you plan to operate, you will run into complications. There's just no way around it. And complicated procedures lead to very stressed doctors who have to manage these complications. And ultimately, that can lead to poorer outcomes, which can lead to unhappy patients. Intraoperative complications, as opposed to post-operative complications, are unique in that you oftentimes have to make decisions very quickly. You have to assess the situation, make a decision, and take care of it. Seconds can really make a difference with LASIK intraoperative complications. And so recognizing the complication, knowing that they're out there, minimizing your risk factors, and then managing is all very important. To that point, the syllabus today for my talk reviews the complications, the risk factors, and the management options. But in the 7 minutes allotted to me, I wanted to present a method for managing complications that really focuses more on how can you keep calm and carry on when these arise, and I call it the what went right method. It's kind of a take on the compliment sandwich. So when a complication arises, think to yourself first, what went right, what is in my favor, then critically assess what's gone wrong, and then go back to what went right and say to yourself, how can I fix this problem and get good outcomes for my patient? And then last, while we have this world-renowned panel here, I'd like to kind of get their input on how they might have managed some of these cases a little bit differently, because of course that's the art of surgery. So intraoperative flap complications can be broken down into microkeratome versus femto complications, and they can range anywhere from seemingly benign things like epithelial defects and OBL to more anxiety-provoking and challenging things like buttonholes and vertical gas breakthrough. For me, the ultimate what went right when it comes down to even showing up to the laser vision correction suite is that the literature is on our side. Study after study after review after study shows that LASIK is safe and that we have very low complication rates, and you can still have excellent outcomes if these are managed correctly. So we're going to start with a video here. Let's see. And this is a pretty typical LASIK flap creation. I use the Intraless IFS, so my flaps take about 12 seconds to make. And I'm feeling pretty good about this right now. Everything's going really well, but I'm starting to get a little pit in my stomach. And I think to myself, oh gosh, not sure about that. But before we go there, I'm going to go ahead and tell myself what went right. So my meniscus maintained full and complete the whole time. I have a nice, large, round raster pattern. But let's talk about what went wrong. And here, there we go. We're going to play it about halfway through the raster pattern. You can see on that upper corner here those bubbles, and now take a look. You'll see quickly that that side cut was just beyond my raster pattern in that upper corner there. So what am I going to say to myself to keep myself calm, to carry on? All right, well, listen, this patient has a low myopic treatment. It's a small optical zone. I have this large raster pattern. This could still turn out okay. So the moment of truth, here we go as we complete the case. I go to lift my flap. By habit, I go to the area where I normally start it, and then I say to myself, no, I'm going to start on the other side where I know my raster pattern and my side cut were great. I slowly, deliberately try to open this up. I'm running into some areas where it's not opening as quickly, but I'm going to continue. If I were unable to open this up, what I probably would have done is just lay it back down, wait 2 weeks, and come back and do an advanced surface ablation if the refraction and the topo were complete. But here I'm getting most of it, except for this one small area. And so it's a very small area. I'm going to open up my flap, and then I'll go ahead and reflect it back. That stromal bed looks great. I proceed with the case. So what went right? I was able to dissect carefully under most of the flap without issue. What went wrong? I still had a little bit of an incomplete flap for about 1 clock hour. And what went right? I could take the Van Ness scissors, dissect that last part. The bed looks great, and I could get a good outcome. There's one more case I want to present before we turn to the panel. As we know, suction loss is very common. There you saw it. Again, that 12 seconds, it can happen very quickly. We know that there are risk factors. Inexperienced surgeons tend to have more suction loss. But this patient, he was actually a very anxious patient and had deep-set eyes. And this video isn't on loop. This is just me trying to condense about 15 minutes of trying to get that suction ring back on the eye over and over again. And I got it on about 4 times. I made 2 raster passes, the initial one, and then this last one, where I was finally able to complete the raster pattern, the side cut, lift the flap, and complete the case, and we did well. So case discussion here, what went right? I was able to achieve suction and complete my flap and get a good outcome, but what went wrong? My patient, it was very traumatic for him. At the 6-month visit, at the 12-month visit, he came to me and said, that was really challenging for me. So what could have gone more right? Well, I started thinking about it, and I thought, you know, it would have been so much nicer if at some point after the 3rd or 4th suction loss, when he really needed to take a break, that I could just say to him, why don't we convert to advanced surface ablation? Why not consent these patients preoperatively if I know they have one of these known risk factors for possible advanced surface ablation with the LASIK? At that time, they've already have Valium. I can't consent them. So this was something that changed in my practice. So now in the time I have remaining, I'd like to just turn it to the panel. For case 1, by a show of hands, would anyone have done anything differently with that case? Maybe we can go back to that last slide or whatever.
I thought you did a great job, and I like your positive attitude with all this stuff, because sometimes it's easy to lose it, so just staying calm, like you said, is the most important thing. But in such a small area, I really like the way you treated that case. I would have done the exact same thing, but if it were a much, much larger area, maybe go to PRK or advanced surface ablation. Same with the second case, but nicely handled.
How many people would retreat or redo their flap later down the road, obviously? If you had to lay the flap back down, is anyone still making a new flap deeper, or I prefer surface ablation over that. I wait a couple of weeks, wait for the refractive stability. Anyone still interested in doing another flap?
Yeah, I definitely at that point think it's not a bad idea to go to surface ablation. It's very safe. I do recommend mitomycin C in that situation as well, because there was a attempted flap, but I think it's a very nice option.
The second case, I think it's a surface ablation candidate, definitely. That orbits and the struggling, but you did manage very nicely, and you're brave to complete the procedure. But sometimes I tell my patients and my colleagues that are doing surgery, you don't need to be brave. There's nothing to be proven out. PRK is always a great talk.
Great outcomes, absolutely. I tell all of my patients, listen, 1/3 of my patients automatically are going to be PRK, so it's a great procedure. You don't have to worry that you're going to have a worse outcome. It just may take a little bit longer to get there. I had one final slide that was just the completion. So thank you. If the what went right method resonates with you, please adopt it. Otherwise, keep calm and carry on.